Type 2 diabetes is something that affects many Americans, both men and women. Women become more vulnerable to developing type 2 diabetes as they are transitioning from perimenopause, the years leading up to menopause, into menopause. And this is due to several hormonal shifts. But I want to focus today on is some myths concerning type 2 diabetes, why it's important for all of us to be aware of our blood sugar, and also what we can do about it as well as the causes. So, type 2 diabetes is not something that we can decide we don't have or we have based on how we look. We can become pre diabetic, which means we're on the road blood sugar wise to developing type 2 diabetes. But on the outside, we could look perfectly fit. I've had this experience when I go to doctors at times where, because I'm in shape and they see muscle on my body, they see that I'm moving well, they automatically will sometimes assume that all of my blood work is going to come back perfect and that I have no issues whatsoever. I've recently been having some cardiovascular issues, and they are mild at this point and believed to be something that I may have been born with. I've had a heart murmur since I was in my 30s, and it's become more pronounced, and I have some aortic stenosis. It's very mild at this point, but I am following up with a cardiologist. But this is a perfect example of me looking fit and healthy and slim on the outside, but there might be an underlying issue. The same can occur with blood sugar. So we could have blood sugar dysregulation, meaning that it is too high or at times too low, or we're having spikes, or it's continually high, chronically high, and leading to diabetes. We could have this situation occurring in our bodies even if we're slender and even if we're at the gym and lifting weights and doing all of the things, because there are so many different things that can affect our blood glucose levels. So that's why it's important, even if you think this podcast does not apply to you, I'm going to urge you to listen in. Now, of course, I am not a doctor, I am not a medical professional, so I advise you to consult with whoever is in charge of your medical care, your medical team, because ultimately that's who you need to be making the decisions with. I just want to present some of the facts around type 2 diabetes and some of the things that we can be aware of so that we can change things. So, first of all, there are a few myths that I think are really important to debunk. Number one myth that I see is people assume that people with type 2 diabetes or have type 2 diabetes, they assume that they are lazy and that they don't care, that they've just thrown it all away and they don't care about their health. This is a myth. I am going to say that most people do not start their day by saying, I'm lazy, I don't care, I don't care if I have type 2 diabetes, I don't care about my health. Number two for a myth is that everyone responds the same to food. So in other words, I eat a sweet potato, you eat a sweet potato, your neighbor eats a sweet potato. Sweet potatoes are healthy, so none of us have a high blood sugar spike. And that's simply not true. Yes, sweet potatoes are healthy, but there's some people that have a very big blood glucose spike when they eat a sweet potato. I might eat beans and I have no response, but you have a high response. So there are always these situations where people respond outside of the norms. We might say, okay, this food generally spikes blood glucose, but there is that bio-individuality that we must take into account. And number three, and I alluded to this earlier, is a myth that you have to be overweight to have blood sugar dysregulation, prediabetes, or type 2 diabetes. And that simply is not true. Yes, weight can be a factor, but you can still have blood sugar dysregulation and be slender. And I'm going to give you some examples, even with myself, where I have seen blood sugar spikes when I'm doing everything right in my day and exercising correctly and eating all of the nutritious foods, and my macronutrients are balanced, but yet I am having an unhealthy spike. And I'll give you some examples of that in a few moments. So, what are the causes? And you may know some of these, but bear with me here because I think it's important to set the stage, get the myths out of the way, and then let's talk about some of the things that can cause this situation. Now, obviously, as we have these hormonal changes from perimenopause to menopause, there are some changes in hormones that can affect blood sugar through a series of processes within our body. And I'll get into that in a bit as well. So that can be not necessarily what I would call a cause, but it can increase the chances of developing this if we aren't paying attention to certain things. So number one, nutrition. Obviously, that's going to be the gold standard by which we look at preventing the possibility of developing type 2 diabetes. It is not the only thing, but it is a major factor. It's a major player. And several things can happen here. Undereating and overeating can cause blood sugar dysregulation. If you are constantly skipping meals, and this falls under the under eating, not getting the proper macronutrients within your feeding window. Now, as you know, I run an intermittent fasting program. I have 45, a group program, and I do see benefits with intermittent fasting for health and potentially for longevity and health span, quality of life. In particular, I like the autophagy with intermittent fasting. Autophagy is basically cellular rejuvenation and repair that occurs when we're fasting. With that being said, I think there's things that we need to take into account if we're going to consider intermittent fasting. We don't want to overfast, undereat, and overexercise. That could set yourself up for some blood sugar dysregulation. So we always want to be paying attention to things such as energy level, how well we slept. And I am fond of anywhere from a 12 to 16-hour window. I toggle that switch constantly. Sometimes I go 16 hours, no problem, lots of energy, slept well. Sometimes it's going to be more like 12 to 14 hours, and I'm continually changing that. And so then we have to take that bio-individuality into account. So when I say skipping meals, I'm not necessarily saying intermittent fasting is a bad thing to do for blood glucose levels. What I'm saying is that, first of all, you have that bio-individuality, you have your lifestyle, what are you going through, what kind of stress are you under, your sleep, all of this plays into whether or not you should be intermittent fasting and how you should intermittent fast. Next up are macronutrients. These are your protein, carbs, and fats. It's important that these are in balance. In particular, the carbohydrates. What I see is this automatic assumption that we should jump onto keto when we're having blood sugar dysregulation, pre-diabetes, or diabetes, type 2 diabetes. That's not necessarily the case. Keto has a place, and there are times that it can be helpful with bringing down high blood glucose levels, but I am not a fan of completely cutting out carbohydrates, completely cutting out a macronutrient group. I feel that even though carbohydrates aren't essential for survival, that they are essential for health and well-being. The problem lies with the type that we eat. Are they ultra refined, ultra processed? And also with the amount we eat. Not everyone can consume the same amount of carbohydrates. For protein, I can make some generalized blanket recommendations on protein for men and women. I cannot do the same with carbohydrates. I cannot tell you here is the exact carbohydrate count, the exact amount of grams that you should be eating within a day, because there's so many things that play into this. And most of us have a carb tipping point, and learning your carb tipping point is really important. It takes a little bit of time and experimentation. How frequently are you exercising? Are you lifting weights? What's the intensity of your workouts? There can even be some genetic factors here. And of course, age and stage of life can play into this. So nutrition has a lot of different balls to juggle. There are a lot of different balls in the air. Number one is just remember bio-individuality. I have worked with vegans and vegetarians that thrive on that particular diet. And then I've had women actually move to more of a, I don't want to say a paleo way of eating, but they begin to incorporate animal protein within their diets and move from a vegan to including animal proteins because they feel better and their body's functioning better. So there is no one size fits all. And I do see people that are an anomaly that defy what would be the generalized rules of what would cause you to thrive and do best nutrition wise. So as far as there being one type of diet, one type of nutrition plan, I believe that this is very bio-individual. We have different gut microbiomes. This can make a difference. We have different tastes and likes. So all of this has to be taken into account. Number two is stress. Stress can raise glucose blood sugar levels via cortisol. So when we're under stress, whether it's chronic or acute, we are going to release cortisol, which can raise blood glucose levels and over time cause an issue. Now, as human beings, we're designed to deal with some stress. And also as human beings, there's a difference in how we handle stress. I tend to be a little bit more sensitive to stressful situations. So if somebody says something mean to me, for example, I know that sounds silly, like I'm back in high school, I tend to take it a little bit more personally than, say, my husband. It bounces off of him. He'll just say, oh, that person's having a bad day or whatever. I don't need to talk to that person. And he's off and going. And I'm over there ruminating over it. So understanding your personality and how you respond to stress is very important. I recently read a book. I don't have the book in front of me, so I can't remember the exact title. It was one that I was reading on Kindle, and it was actually one that I was asked to review. I'm in a publishing Facebook group, and we often do, we're all authors, we will review one another's work. And he had been he's a veteran, so he had served in Kuwait, in Afghanistan, he served in Iraq, and did several tours of duty. And he came home with, first of all, pre-diabetes that eventually went into diabetes that they later determined was caused by his service. And the connection there was PTSD, post-traumatic stress disorder. He had been under constant life-threatening situations, obviously probably had high cortisol chronically, and was probably releasing or had elevated blood glucose, blood sugar levels that went in conjunction with the release of that cortisol. So it's important to, first of all, understand if you're under stress, even past stress, and we'll talk about that in a moment, that falls under trauma, and then how you personally respond to that, because there's a huge difference in our responses. Back to that bio-individuality. Number three is sleep. Sleep increases cravings due to two hormones, primarily leptin and ghrelin. It causes hot flashes even because of elevated blood glucose levels. So I'll back up a moment. The cravings for leptin and ghrelin don't cause elevated cortisol or elevated blood glucose, but you could be having hot flashes during the night that are caused by elevated cortisol, elevated blood glucose levels that are chronic over time. This is an ongoing problem. Your blood sugar is dysregulated, and this dysregulation can actually cause hot flashes. So yes, hot flashes can be caused by our sex hormones or lack of them, such as estrogen, but it can also be caused by stress. Once again, we're back to the stress and the elevated blood glucose levels. So you wake up the next day, or maybe you sat up the whole night, you didn't sleep, you perhaps had these elevated blood sugar levels throughout the night, then you've got these cravings that are caused by the hormones leptin and ghrelin. They are hormones that regulate your hunger. So leptin basically tells you you're satisfied and full. Ghrelin, I think of as the growling stomach telling you you're hungry, and you're typically not hungry for broccoli and asparagus. We are wanting refined carbohydrates. So that can cause a problem if we're eating the wrong foods due to these hormones. Trauma, going back to stress, and I talked about the book that I read. We all have individualized responses to trauma, and it can even be past trauma that suddenly rears its head. I had this happen. I've actually talked about this in my book that I wrote, Finding Purpose in the Pause, and also in past podcasts, that when I was about 53 or so, I started to have a problem processing or not processing some past trauma that I thought was over and done with. Time had taken care of that. But what had happened is I had simply moved forward with my life, gotten married, had kids, gotten busy with a career, kids, husband, family, all of the obligations. And I was so busy that I wasn't processing something from the past that had a profound effect on me. It could be a trauma that you've recently experienced, a car accident. My husband fell off of a roof. This has been, well, about 3 weeks now, and he's okay. He has an ankle injury. We're actually having him go back in because we suspect there's a broken bone in there. But we thought it was a very bad ankle sprain, a very bad sprain in the wrist. So it could have been so much worse than what it was. We are both very thankful to God that nothing worse happened to my husband during this fall. But he happened to have an appointment with our nurse practitioner shortly after the fall, and he had his blood work right before the appointment, and certain markers for inflammation and stress were very elevated. And I told him, I said, you had this trauma. I mean, you probably had these thoughts flashing through your head as you fell off this roof. That's traumatic. You could have lost your life. You could have spine injury, any of these things. And it's traumatic just even imagining what could have happened and the fall itself. So that is a trauma that can actually affect your blood glucose. It obviously is going to raise it because when he went off the roof, the cortisol went up, the blood glucose went up with it. And then I think he had several days afterwards where the aftermath, his cortisol levels were still elevated. He was still in that state of stress. And the blood work that he had done, the lab work that he had done, was showing some of these markers. So it's important to always be looking at what is happening in your life. Where are you at right now? Lack of exercise and lack of the right kind of exercise. I've done several episodes of the podcast, one most recently on strength training. It's that important. And in particular, strength training for the lower body, for your quads, for your hamstrings. These are big muscle groups that can act as a glucose reservoir for this excess glucose. Your muscles are like a sponge for that. So really important to have muscle, which is a metabolically active organ. It's an endocrine organ, the biggest organ in your body. So we think of our skin, think of your muscle from head to toe, how important that is. It's live tissue that we keep it healthy. There are some signs that you can look out for. One in particular comes to mind, and that is being very tired after eating a meal. That will often tell you that perhaps your blood glucose is spiking with those particular foods. So let's say you eat the sweet potato and you think, wow, this is great, so healthy. But right afterward, you want to lay down and take a nap and you feel crashed. Perhaps that sweet potato is spiking your blood sugar. So what can we do? What tests can we do? What can we do to measure this? There is obviously the fasting glucose level that our doctors check. Really important that you are truly fasting. you haven't had food for say 12, 13 hours or so, you haven't had a glass of wine, you haven't had a supplement that maybe is calorie free but has an artificial sweetener, even a natural sweetener. I found when I wore my continuous glucose monitor that things with stevia spiked my blood sugar. Now, there is nothing in the literature that says stevia spikes blood sugar, but when I had certain supplements or protein drinks that contain this, my blood sugar would temporarily spike up. Hemoglobin A1C is another measure that is looking at the protein in red blood cells, and if there's too much blood glucose stuck to that protein, kind of gunking things up, it gets a measure of that. Labs aim for 5.7 to 6.4, but I've heard professionals say let's keep it more around 5, 5.1, 5.2 and under. So there is some debate there because lab levels are constantly changing and they change based on the population. And if you consider if you have an unhealthy population or a metabolically unhealthy population and the lab norms are coming from that population, you just have to take that into account that perhaps you need to look at optimum levels. Fiber is your friend when it comes to blood sugar. It is something that is very effective as a sponge, and it can lower cholesterol levels as well. This falls into, of course, the nutrition camp and is something that you should be tracking. So making sure you're getting enough. A good way to track it is to use a tracker like MyFitnessPal, where you're not only tracking your fiber, but it tracks your nutrients, your sodium, your macronutrients, which are protein, carbs, and fats. And this can all be very helpful for tracking the fiber and making sure that you get enough. I'm not going to give a specific number. Honestly, I've heard so many numbers on fiber, and I've also heard that that bioindividuality that we've been speaking about, that can play into this too. I might not be able to have as much fiber as you can handle. And so we always have to take that into account and move slow and low where fiber is concerned. I had mentioned that muscle is very important and quality muscle. You want active working muscles. You don't need to make this difficult though. Ladies, well, ladies and gentlemen, if you're listening, you can have a set of dumbbells underneath your desk. So if you work from home like I do, you could stash some dumbbells and maybe periodically get up and do some strength training exercises. You can do some wall push-ups, wall sits. You can have some bands, a kettlebell. Just get moving. It doesn't have to be this complex thing. Think again of the legs. As I mentioned, they are more metabolically active than other muscle groups. It's not that other muscle groups don't serve a purpose. They also serve a purpose with glucose regulation and using glucose and being a sink for glucose, a reservoir for glucose. But the muscles on the legs are particularly active. And there's been some research coming out of Europe on this. Next up is a CGM. This kind of goes back to, it's not testing necessarily, because what you're doing is you're monitoring in real time what is happening with your blood glucose levels. And I said I was going to talk about mine and what spiked it. So I found that my protein shake spiked it, and I had to be careful to make sure that there was more fiber and some healthy fat within my protein shake to absorb some of that spike. Because if I just did the straight protein, little bit of fruit, mixed it up with my collagen, I was getting this pretty big glucose spike. And I tested it with some other of my supplement powders that contain sweeteners such as stevia. I don't use the artificial sweeteners, and found that I was getting a spike from this. And so it's important to know what spikes yours. I also found that stress brought my blood glucose levels up extremely high. Remember me telling you I'm sensitive. I was wearing the monitor and had a situation. I won't name names or mention the exact circumstances. I don't I don't like to point fingers and do that kind of thing, but I will tell you the incident. So I had someone who was working for me as a contractor and came back with some unreasonable demands of things this person wanted. It led to a little bit of back and forth. I was trying to handle it in a way that was professional and listening to the person and kind. Essentially, the individual just completely went off on me and was saying some things that were very derogatory, very unkind. Clearly, there was an issue with this individual being able to monitor their emotional responses because the emotional response was way out of proportion to the discussion. And I knew this. I knew that this person was not behaving in a way that was reasonable. And I should have just gone, you know what, this person is having an issue with some emotional regulation. It's them, it's not me. But I took it internally. And as a result, I looked down at that blood glucose, not at the monitor, but at my phone that had the information about the monitor, and was horrified to see those levels just shoot way up as high as they could and quickly, which told me stress has a profound effect. Too much coffee raised my blood glucose. If I had some, I was okay. If I went overboard, not so good. So caffeine had an effect, even though I drank the coffee black. I want to make that very clear. So it's understanding your individual blood glucose level. Should everyone wear a monitor? No, I'm not saying that. Some people will have difficulty. If you're the type of person that ruminates over something, these numbers are really going to bother you. You're going to get upset. Perhaps using some of the other testing methods are better for you, but it can give you real information in real time. And what you know, you can change. If you know a sweet potato spikes your blood sugar, you can maybe minimize that food or replace it. I found out that beans had very little effect on my blood glucose levels. I could have a soup with chicken and veggies and beans, no spike whatsoever, or hardly any at all. Another person might have eaten that soup, spiked it way up. So, this is good information to have so that you can do something about it. And it's also participating in your health. I am a big proponent of participating in your health. When I go to my nurse practitioner, something she does that I love is we sit down together and she has the blood work in front of her, the lab work. She gives me a copy right away. I don't have to ask for a copy. I have my copy. We go over piece by piece and she explains what those numbers mean. Then she explains the protocol. If there's any kind of problem in this test, she explains the protocol that's going to be best for me to bring levels back in balance and treat the situation. I am being an active participant in that. And then I go home, I keep this blood work, I compare it to past blood work I've had, I make some notes on it, I try to learn and understand my body and certain patterns that I see. I'm a participant in my healthcare. So for that reason, I found the blood continuous glucose monitor very helpful. But once again, this is an individual choice. You can also do a pinprick, but who wants to prick themselves all day long? It's painful. But you could even do both to get a accurate reading, because there can be some inaccuracy perhaps in the CGM. So you could do the blood prick as well. So you've got different options there. You've got your lab test, your CGM, and the blood prick, the old finger prick test. What about medications? Now, once again, I'm not a doctor, so I cannot give any advice, but I can share a little bit of my perspective and some information. So metformin is a popular one, and people will go on this with type 2 diabetes. I would say make sure you're going on the medication, make sure you're also working on your lifestyle. I see two groups of people. Some people get very frightened when they get the diagnosis of prediabetes. They want to do everything they can to reverse that. So they do the medication that their doctors recommended, but they're also making some major lifestyle changes. The ones that I spoke about: nutrition, exercise, stress, sleep, past trauma, or current trauma. They're addressing all of these things that make a difference. So with any kind of medication, I am not against medications at all. They serve a purpose. I think one of the good things to come out of Western medicine has been certain medications that can treat everything from infections to high cholesterol, cardiovascular, type 2 diabetes. There are good medications that can make a difference. So I am never one to say, just take these supplements and do this and that's it. But we should try to avoid medication first of all if we can, and then if we can't, make sure you're combining that with lifestyle habits. See it as a wake-up call that you're on the medicine and that you need more to support that. There is also some new medications coming out for weight loss, the injection form, that are meant for type 2 diabetes or for morbid obesity. And they weren't really meant for a weight loss of 5 to 15 pounds. I've heard mixed things. Once again, I am not a practitioner. I'm not a medical practitioner. This is what I see. If you have the injections, this peptide, which is what it is, and you lose the 10 pounds, 15 pounds, 20 pounds, even 30 pounds, but you don't address those lifestyle habits, chances are the weight is going to come right back on. So that's where I'm at with those medications. I don't have enough information on the efficacy, the safety to make any judgment calls on this. But I would say if you are considered or considering one of these injections for weight loss that is a type 2 diabetes or obesity treatment, that you should be addressing your lifestyle habits. You should be working with a nutritionist, you should be working with a coach, a health coach of some kind, or your practitioner to come up with a plan that helps you address all of the lifestyle habits. Because the information that I've been receiving is people are losing weight, people are getting results, and then they're putting it right back on. And so then you're in a yo-yo dieting scenario, which is never a healthy one to be in. So let's go back through, let's swing back around and talk about some of the things that we have discussed and put it all together. So you have your nutrition piece. You don't want to be under eating or overeating, and this includes intermittent fasting. If you're intermittent fasting, do so responsibly with the right information, implement it properly, and don't overfast. You don't want to be aware of keto. Keto might be helpful in the short term, but being on it long term, there are consequences to this. One of them is the thyroid. You can lose thyroid function if you are on keto for a long period of time. So it's something to consider. Your carb threshold, how many carbs can you handle? This takes a little bit of time, and it may change with your activity level and your age and stage of life. Next up is addressing stress, because it raises cortisol, which in turn raises blood sugar levels, which obviously will dysregulate your glucose levels and could potentially lead to some problems such as type 2 diabetes. So be aware of what kind of person you are when it comes to stress. If you know you're overly sensitive, start putting some stress management things in place. Perhaps it's to journal or box breathe or stop. This is what I do. I'll stop in the moment and say, is this really that big of a deal? And in 1 year, am I going to be talking about this? In 6 months, am I going to be talking about this? And oftentimes, it's not as big a deal as what I've made of it. Next up is sleep. As I mentioned, it can cause cravings because it dysregulates some not blood, but some hunger hormones that are important for appetite control and satiety. Along with sleep, if you are experiencing blood sugar dysregulation, blood glucose dysregulation, you could be having some hot flashes. You could even be having, of course, the hot flashes that we think of that come from estrogen along with menopause. And if you're losing sleep, that's going to be an issue. So that has to be addressed. Past trauma, even current trauma. Recognize if it's starting to come back up. I do see this a lot with midlife women. I can't tell you the exact psychological reasons for this, but I can say that from an anecdotal perspective, within my coaching business and practice, I have seen many women that start down this journey of improving their health, losing weight, whatever this looks like for them, and suddenly they're dealing with some kind of past trauma that they have never dealt with. An example of this is being overweight, and when you go to lose the weight, all of a sudden there's a fear of visibility. That's a real common one. Oh, I'm being seen. I could be seen. I could be seen as looking attractive. People are going to notice the weight loss. And sometimes that fear of visibility has some trauma behind it. And then, of course, the right kind of exercise is critical. Strength training. Of course, even just taking a walk after a meal can lower your blood glucose. So I encourage you, start where you're at. If it's starting with a walk, that's fine. Right now, I'm helping a friend who is getting back into some movement after years of not having any movement. She suffered a very tragic loss of a child, and as a consequence, the exercise just got dropped. Her health just got dropped. And right now she's just walking. And I'm not even talking to her about the strength training. Do I think she needs it? Yes. But I think we have to start where we're at. We can't overwhelm ourselves. So if it's to take a 10, 15, 20-minute walk, if it's to get up and walk around the office, all of that matters. Just start where you're at. So I hope this was helpful. I do have a brand new book out, Finding Purpose in the Pause, Your Guide to Thriving in Menopause and Beyond. I have put a link in the show notes to this book, or you can go to my website and there'll be a pop-up for the book. It's carolcovino.com. That's carolcovino.com, and it instantly pops up. And you can find my book on Amazon as well if you just want to head straight to Amazon. I do have a free bonus if you put the order number from Amazon in a form, which is on that page that I just told you about on my website. So you purchase the book, you go back, you pop in the order number. I know it's a couple different steps, but I have a great free bonus for you, the 14-day nutrition detox. So you will get that for free just by supporting my book and helping me to get it out into the world. So I hope this was helpful for you, and wherever you are in the world, I wish you every blessing. Bye-bye.